the senator from Minnesota.
Mr. President, I join my colleague from Michigan, as well as Senators Welch and Shaheen and the others that come before this body today to talk about what's really happening out there. Well, what's really happening out there is that we are in a healthcare crisis, and that is because the big, beautiful betrayal of a bill will kick 15 million Americans off their health care, force hospitals, health clinics, and nursing homes to close, and this is already happening with the premium notices, with what they're already seeing. It is raising costs for everyday Americans. And now, if Congress doesn't act to extend the Affordable Care Act's health care tax credits before they expire, more than 20 million Americans will see their premiums soar, putting their coverage at risk. I go to all 87 counties in my state every single year, and I visit rural hospitals. I know what's happening out there. I know what's happening to people who are in small businesses, who rely on the Affordable Care Act, who are already seeing increased grocery costs, are already seeing increased electricity costs, and are already seeing dried up markets because of these tariffs. This is all hitting them at once. At the end of the day, everything from regular checkups and life-saving prescriptions to hospital visits and long-term care is under threat. Not for the wealthiest. They're going to be able to handle it. Maybe not even for people in some of the big cities. But for people out there in rural right now, they're barely holding on as it is. And this is on top of the funding cuts to public health and medical research that extinguish hope for life-saving cures and jeopardize America's global leadership in medical innovation. Those people are holding on too. Just last weekend, I went with the Parkinson's Association on their charity walk. Those people are holding on for hope. In their wheelchairs, they're holding on for hope, their daughters and sons, their brothers and sisters. And we are so close in so many areas because of the mapping of the human genome, because of AI, as this is coming from the home of the Mayo Clinic, Minnesota, that we do not want to go backwards when it comes to investment in research. That's why my Democratic colleagues and I are fighting to restore health care in this upcoming budget bill. Right now, health care access for more than 20 million Americans who benefit from health care tax credits are at risk, as I just noted. And as a result, a record number of Americans, 24 million people, have been enrolled in this Affordable Care Act, but all of them are going to see this increase if something isn't done. This will be a massive hit to working families. It will be especially harmful to middle-class families, small business owners and entrepreneurs, seniors, and people living in rural communities. It will force states to reduce coverage and shift resources away from other priorities like education and public safety. In Minnesota, at least 9 rural hospitals are at immediate risk of having to shut their doors and stop providing care. Medicare, Medicaid, and enhanced health care tax credits are overwhelmingly supported by Americans. Why? Because this is about their families. This is about the fact that they know that health care over the years, they've seen the prices, what's happened, they've seen what's happened with pharmaceuticals, and they expect us to do better than what's happening now. They expect us to do better than putting forward this bill that just happened that hurts their rural hospitals, or throw people off of their coverage, or stop life-saving research on these cures that has always been so bipartisan, or the rhetoric around vaccines, which so many of them know their kids need. I just found out this year I had no immunity to measles because I had that shot, but it was at the wrong time, so I got that vaccine. But right now, so many people don't even know when they turn on the TV and they hear the HHS secretary question these vaccines against the belief of a number of people on the other side of the aisle, the senators, Republican senators, including those who are doctors. This is just creating massive chaos. Costs are up, chaos is up, confusion is up. We must do better. More insured Americans is good for patients, good for families, and good for our country. More research paves the way for cutting-edge treatments and the cures of tomorrow. Mr. President, I yield the floor. Thank you.